American Heart Association's National Wear Red Day is recognized by Mount Sinai Heart Institute. Your heart in the best hands.
The Mount Sinai Heart Institute, in affiliation with New York's Ivy League Columbia University, is Florida's leading heart program. We offer the most advanced, least invasive surgical options. The Mount Sinai Heart Institute has the best heart attack survival rate in Florida and some of the best surgical outcomes in the nation. U.S. News recognizes Mount Sinai as the only high-performing heart hospital in Miami-Dade. Mount Sinai Heart Institute, your heart in the best hands.
Did you know the hospital with the best heart attack survival rate in all of Florida is in our area? Hi, I'm Beatrice Canals, inviting you to watch your heart in the best hands. Find out why Mount Sinai is Florida's leading heart hospital. Welcome to Your Heart in the Best Hands. I'm Beatrice Canals at Mount Sinai Medical Center on Miami Beach, Florida's leading heart hospital. Founded in 1949 by a group of visionary individuals who sought to establish a hospital where doctors could practice and patients could receive care without discrimination. Mount Sinai has grown from a small community hospital to a world-class academic medical center with multiple locations throughout Miami-Dade. Hypertension is often referred to as the silent killer. Left untreated or mismanaged, the results can be devastating. Mount Sinai's Chief of Cardiology, Dr. Gervasio Lamas, explains why managing your blood pressure is so important and why second opinions are so valuable.
Hypertension in layman's terms is really high blood pressure. And what that really means is that the amount of pressure that the blood exerts against the walls of the artery is more than normal or more than would be desirable for the blood vessels. So a normal, sort of rock normal blood pressure is 120 over 80. As people get older, their blood pressure rises. We used to think that that was normal. It's not quite normal because the higher the pressure inside the arteries, the more damage is done to the walls of the artery. The walls thicken and they lose a lot of their normal function. The other thing that happens is that the heart has to pump harder against the pressure in order to get the blood out of the heart to perform its vital functions. The reason that hypertension or high blood pressure is called a silent killer is that it can kill you. It can cause a stroke, it can cause your kidneys to fail, and it can cause a heart attack. And it can do so without producing any symptoms until the very end. So most of my patients who have high blood pressure do not necessarily feel any symptoms that their pressure is high. Most people, when their blood pressure is high, they don't feel it. Some get headaches. The majority are completely fine, or so they think. And yet the damage is being done silently. So whenever you see a blood pressure machine in a drugstore or a supermarket, just sit at it, stick your arm in it, and measure your blood pressure. One of the strengths that we have at Mount Sinai is that we have a really devoted team and an expert team to treat patients with high blood pressure. And I can tell you, you can always get the blood pressure under control, and you can always get it under control in a way that the patient feels good, that they feel better than when they showed up. A patient has to be, to a certain extent, in charge of their health care. And there are many times when another opinion from an expert, as we have here at the Mount Sinai Heart Institute, can really get you on the right path. The most important part and the most difficult part of the second opinion is telling your own doctor, with whom you have a relationship, perhaps for many years, that you would like to get another opinion on your illness. That's tough. And many patients don't get control of their health care because they're afraid of saying that to their physician. And when a patient asks me if they can get a second opinion, I say, absolutely. And that's really what your doctor should be saying to you.
When I was 15 or 16, I actually was first diagnosed with AV block. I actually got a pacemaker for that when I was 19. And I've always known about the mitral valve prolapse, but I was told that I only needed to get it checked up on every once in a while, and that I was completely healthy otherwise. And I didn't know anything different until about 6 months ago.
She had an echocardiogram that showed that her mitral valve was leaking. The heart starts enlarging and the lungs become congested with blood, so then she begins to experience shortness of breath.
When I first got my diagnosis, I was obviously very scared, but it was very short-lived. I'm incredibly blessed with a very supportive family.
Sarah's an interesting case because she's a young patient. They want a minimally invasive approach. They want a non-sternal splitting operation. When you're young, you actually don't expect problems because you think that nothing's going to happen to you. But somebody like Sarah, for instance, who is undergoing heart surgery, she may not understand the magnitude of it, but there's a lot of details that are involved in the ultimate outcome.
Mount Sinai Heart Institute, your heart in the best hands. More on Sarah's story coming up.
It's been 5 weeks since my surgery, and I feel great. I've started cardiac rehab and back doing a lot of my normal activities. I'm very grateful that I got this kind of surgery.
So the way I did the operation was through a 5-centimeter incision between the ribs. And in fact, I not only did one valve, but I did 2 valves. And this technique is one that I've coined as the Miami method.
This procedure and Dr. Lamos's team has really given me a chance to live a normal life.
Sarah had an excellent recovery. She was in the hospital 4 to 5 days, and she's back to a normal lifestyle.
Everybody that's coming through their doors is a heart patient, and it's a scary thing. That's why they provide the best care, and I felt that the entire time that I stayed here.
I'm actually very proud to be here at Mount Sinai Hospital and be able to offer not only this procedure, but every type of cardiac surgical option available.
Doing more activities and just really kind of jumping into life, I guess.
Mount Sinai Heart Institute, your heart in the best hands.